So David Klein with the EMS Operations Division. We're now going to talk about something that's been happening, that we've had several cases in the county of where our personnel have been actually stuck by sharps. A couple of them happened because of the sharps containers. Sharps containers are only for lancets, for IV catheters, or for needles, or for the actual catheter themselves if it comes out of the patient because we've de-seated it. Sharps containers are not for any type of trash. They're not for 4x4s, they're not for little pieces of plastic, they're not for alcohol swabs, they're not for syringes. Even the actual vial of epi, the 1 to 10,000 that you inject, the needle, if you happen to have a needle on there, needs to be disposed of properly. The actual other medication, the glass vial, can actually go in a bio bag. We are setting not only potentially yourself, but your fellow crew up by stuffing trash in here and a lot of syringes to the point where people are trying to jam their finger into the sharps containers to get the catheter in there and doing an inadvertent needle stick. So once again, you've got your catheter, it's safely, the needle is retracted in the plastic, is safe, sharps container. Let's say we actually give a medication by needle. All of our needles here in Cobb County are needleless. So once you've administered the medication, you flip it forward. My needle is encased in plastic, it's safe. Twist off, sharps container. The syringe and the rest of the trash can go in a bio bag. These are weighed at the proper disposal. The more trash that's in here, the faster we go through our sharps container, the more of a cost issue it is. If it's just catheters and needles, these sharps containers last for a long time, and they more importantly prevent you or your fellow firefighter from having an inadvertent needle stick. Here is an actual sharps containers from the field that we've taken a picture of. As you can see, there's trash in here. There's actually 4x4s and some alcohol swabs. Look at all the syringes and the glass vials that are put in there. It is physically hard to be able to properly dispose of a catheter, a needle, or a lancet in here. There's physically no room for you to push anything in here without putting a lot of pressure behind it and potentially putting your finger in and getting an inadvertent needle stick. If you have any questions or need any type of further training, contact the EMS Operations Division.